I take care of patients with Crohn's disease and ulcerative colitis as my primary clinical interest. I run the inflammatory bowel disease program and see patients in clinic with inflammatory bowel disease, have a research lab that studies inflammatory bowel disease. This gives me a nice perspective, gives me kind of a connection between what happens in the lab and the scientific advances and patient care that I think is really powerful and adds to, the overall ability to take good care of patients. It's really important to connect on multiple levels. It makes no sense to take care of them from, do their colonoscopies and their x-rays and design their medicine if you really don't know what's going on in the patient's life, if you have no idea how the stresses can affect their disease process or what role that plays. And so, I think from a satisfaction point of view, from my own academic satisfaction, if you don't connect with the patient, then kind of what's the point? It's really nice to be able to talk to the patient, learn what their life is like, how the disease affects their life, and how they can help kind of manage their disease. Our whole approach is really to develop that kind of a bond with the patient so that they understand the disease, understand why we as physicians are oftentimes in the position of asking them to take, potentially serious medications or do tests that are invasive. They need to understand that, I think, so that they can be part of the process.